Okay, thank you. All right. So before we get started, I'd like to talk to you a little bit about Mental Health America of Greater Houston, or we refer to it as MHAGH for short. Our organization's mission is to drive community solutions to promote mental health for all, and we do that by utilizing education, advocacy, collaboration to drive systems change through collective impact. And within MHA, our department is called the Integrated Healthcare Initiative. And what we do is that we create partnerships, provide leadership and vision. We advocate and educate. We provide technical assistance to implement and sustain efforts that promote integrated healthcare. And our vision is that integrated healthcare is accessible and cost-effective and the standard delivery of care for all. So as I dive into talking more about ECHO, I think it's very important to first mention a little bit about what integrated behavioral health is, especially if you're new to our ECHO info session or even any trainings that we've provided. So IBH is Integrated Behavioral Health is the overarching framework our department and the work within our department is based on. Everything we do aims to bring together primary care and behavioral or mental health under one clinic with the same set of providers, providing that integration between the two services, right? So integrated behavioral health is the care that results from a practice team of primary care and behavioral health clinicians working together with patients and families using a systemic and cost-effective approach to provide patient-centered care of a defined population. The team addresses mental health, substance use, and behaviors that affect physical health, which are identified during the primary care visit. So in a nutshell, IBH is bringing wholesome care into primary care clinics. So instead of just being treated for physical illnesses, the PCP's office should have the capacity to address mental or behavioral issues by adding a mental and behavioral health provider to their team and working with them. All right, so in the next few slides, I'll go over the details of Project ECHO. So for those of you who are not familiar with Project ECHO, it is a practice model that expands training and practitioner knowledge worldwide. It was first developed in New Mexico, where a lot of these clinicians came together to share cases and educate everybody on a national level, international level. So the ECHO model connects a group of community providers with specialists at centers of excellence in collaborative sessions. And additionally, these sessions are actually designed around a case-based learning and mentorship, where it helps workers gain expertise required to provide the needed services. The providers who attend, they gain skills and confidence. The specialists that attend, they learn new approaches for applying their knowledge across diverse cultural and geographical contexts. And as for in the past, a lot of our ECHO presenters and our audiences, such as yourself, have been attending mostly from Texas, but also around the United States, where they bring in a lot of the knowledge from different state levels and how PCBH looks in their community, in their clinics. So the format, our ECHO formats are usually where the first 25 to 35 minutes of the presentation is a didactic lecture, and then it's followed by a discussion of submitted cases or even case studies brought on by the speakers. And then we'll also have time for question and answer. So once you do register for our ECHO, you will get reminder emails a week prior to these sessions, and you also have calendar invites. But in those emails, we will include a link, a case consultation link, where you as a participant can submit your questions, your cases, or challenges. And then prior to the session itself, we will share that with the faculty members so that they can address this during the lecture portion or Q&A portion of the ECHO. So please be on the lookout for those reminder emails, and we do strongly encourage the consultation forms to be filled out so that you can have an optimized learning session. And then, as IBH it still remains a widely acceptable practice. Providers throughout the state of Texas still continue to find challenges in understanding the model and successfully implementing it. And that's why our ECHO here will focus on just the primary care behavioral health model and how all the ins and outs of it. So what is PCBH, right? So the PCBH model, it aims to improve and promote overall health within the general population in a primary care clinic. This model is important because I'm sure you guys most of the chat I'm seeing clinicians, but that approximately half of our patients in primary care present with psychiatric comorbidities. And 60% of psychiatric illnesses are treated in primary care anyway. And a lot of the studies show, give me 1 second. My computer just went blank. A lot of the studies show that 79% of antidepressant prescriptions are actually written by providers who are not in mental health care. And those who are actually suicidal, a large percent of them visit their PCP's office prior to attempting suicide. So the PCP's office is actually the first step for patients seeking help when they're having challenges with their own mental and behavioral health issues. So the overarching goal is to ensure that the primary care team within this model has the ability to manage and treat behavioral, mental, and physical health problems that are quite common in primary care. So that can look a lot like depression, anxiety, pain management, substance use, obesity, and more. So the key components of the PCBH model includes the approach being population-based, which means they target the wellness of an entire clinic by taking it a step further to reach out to patients than just waiting for them to self-identify their issues. This approach also uses evidence-based treatments or interventions for any given problems, such as what I mentioned earlier, like depression, anxiety, and such. The evidence-based interventions are also considered very brief, where they are time limited, and it's focused on brief therapeutic approaches to address these specific issues. And the goal is that the time constraints actually align with the format of primary care visits, where they aim to provide targeted support that is effective and straight to the point in a short amount of appointment time. And I think it's also important to share the key members of this model include obviously the primary care physician, the patients themselves and their families, the supporting office staff such as the nurses, the medical staff, medical assistants, and even the front office staff. And last but most importantly, the licensed behavioral health professionals that are considered behavioral health consultants, or BHCs for short. So a BHC is really what makes a difference in the PCP's office, where they sort of step in as the behavioral health expert to treat patients alongside their PCP within a 15 to 20 minute time frame using evidence-based interventions. And these individuals, at least in the state of Texas, who is allowed to bill are licensed clinical social workers, psychologists, licensed professional counselors, and even licensed marriage and family therapists. And next slide. Okay. So this, I just really like sharing this slide because this is a word cloud that summarizes the PCBH concept in a nutshell. This was actually created by an activity we conducted during one of our earlier PCBH trainings, and a lot of our audiences were asked to kind of type out what it means for them, or like what does PCBH mean to them and what's their understanding of it. And so this is kind of what we've composed, and I just thought it would be nice to share in this presentation for those of you who like pictures and you guys are visual learners. But moving on. Okay, there we go. The session schedule for this year. So I didn't mention this earlier, but once you register for this ECHO, our goal is to provide a complete run through of the PCBH model from how to get started to who to add to your team to how to sustain this model. So this will be a 16-month long series where we start this coming Monday, actually April 8th. And we and it's held once a month, every second Monday of the month, from now in April, starting next Monday to July, from 12 p.m. to 1:30 p.m. Central Time. Excuse me. And the topics, like I mentioned, it dives into the various aspects, such as discussing leadership commitments, what it takes for an organization to commit to PCBH, what are the different roles that are needed to successfully implement this model. And we, in fact, actually go one-on-one about it. Like in October, November, and December, our presentation focuses on the individual role of a PCBH program implementation lead, the PCP itself and what's their role in the PCBH model, the BHC and how they can contribute to the PCBH model. And I think this Echo series will be a great opportunity for your team and yourself to attend if you guys are planning on transitioning to this model. And then the next year, the remaining topics for 2025, starting all the way in January, is that we'll have presenters come in and talk about the competent trainings that you as a team could have, how to create a workflow for your clinic, the importance of documentation, EHR standardization, and record keeping. And then, of course, the billing, the financing, the revenue cycle management, and we'll end it all with how to sustain the PCBH model from an operational and financial standpoint. All right, so now that I've shared the topics with you, these are the subject matter experts who will be delivering those topics that I just mentioned. Starting off with Dr. Stacy Oakbide. She's nationally known for her work in PCBH. She's currently at University of Texas Health San Antonio, working there as a dean of the medical school. And she's also one of our faculty for one of the workforce development program for BHCs only, led by our organization. Then we have Dr. Ebony Winford with Cherokee Health Systems in Tennessee. She's quite great at what she does. Her clinic already has implemented PCBH, and they're doing a wonderful job there, and they have such a great system going on. So she'll be bringing her plethora of knowledge and information to you. And then we have Dr. Gabriela Gibson Lopez. She also works alongside Dr. Oakbide at UT Health San Antonio. And lastly, we have Dr. Christy Ward with Share Ourselves Health. And, you know, these, I'm sure to those of you who are a repeat, all these faculty members should be familiar to you, as we've been working with all of them for a very long time, actually. And they're all known for their well-known work with the PCBH model, either at their clinic or with research or in some form. And so especially just coming back to Dr. Oakbide, we, Mental Health America, we've partnered with Dr. Oakbide to develop a workforce development program specifically targeting to train licensed behavioral health providers to work within primary care setting. But before I get into that, I'm just going to share this slide, which has the link for you to register for our Echo series. You can use your phone, take a picture of it, or open up the camera app on your phone, and it will take you directly to the registration link. I'll leave this up for a few minutes while I briefly review the chat for any questions, comments, or concerns. And even if I do move on before you're able to glance at this or go to the link, we'll include this link in the follow-up email. So I'll give you guys a few minutes. We have people from Columbia, Missouri. Welcome. Great to have you. We have people from Arizona. Wonderful. Welcome. New Jersey. Wonderful. Awesome. Thank you all for attending our ECHO. We have such a diverse group of people attending today. Okay, so I'll move on. But again, our first session is this coming Monday at 12 Central Time, led by Dr. Stacy Oakby herself on the topic of introducing the PCBH model. And then and just coming back to the workforce development program, I thought this will be a great opportunity to let you all know, considering that we have so many people from outside of Texas, we are actually about to kickstart our third cohort of the Behavioral Health Consultant Certificate Program in February of 2025. And this year we are actually, I'm sure you've heard of this if you've been to our presentations before, but this year we're transitioning it to an all virtual program targeting people all around the nation. It is an 8-month-long self-paced course with 4 virtual live sessions, and there's more details, on this slide. Like I said, it begins next February. It's 8 months long, all virtual. It will include 4 live training sessions where you'll start off with a boot camp. It's all day long, like a work day on a Monday, and then you'll have a refresher course that's a couple of hours long, and then you'll have 2 other sessions where you get to practice with standardized patients. And our only eligibility requirement is that you must be licensed as a clinical social worker or a psychologist or a LMFT or even an LPC, and you have to work in primary care. Those are our only requirements, and we'll actually open the applications in a couple of weeks, and details will be shared soon with you. And if you are curious to learn more about this course, we do have information sessions coming up on May 22nd and August 7th. And we'll include the registration links in the follow-up email for this meeting. So if you have any questions, I'm the point of contact, or you can respond to any email that's being sent out to you, and we'll be more than happy to get this back to you. But this concludes the information session for our Project ECHO for PCBH. Thank you all for joining us today. I can stay back a few minutes to answer any questions you may have. Other than that, you are welcome to leave. Thank you, and have a great rest of your week. I told you it's going to be quite short. Let me check the chat. Wonderful. Thank you, everyone. All right. I don't think we have any questions, so I can go ahead and end the meeting. Thank you, Victoria. You want to stop recording?